In this video, I will be discussing a study titled Effect of Open Kinetic Chain Exercises versus Closed Kinetic Chain Exercises in ACL Rehabilitation on knee joint pain, laxity, extensor muscle strength and function. Now, this was not just a single trial but a systematic review, which means that the authors collected and analyzed the best available studies on this topic to see which out of these two exercises has a better outcome in patients with ACL reconstruction or injury. What are the objectives of the study? The primary objective of the study was to compare the effect of open kinetic chain exercises and closed kinetic chain exercises on four things. First is knee joint pain, second is knee laxity, third is quadriceps muscle strength, and last is functional performance. Secondary objectives of the study are: first, to compare the effect of these exercises on both operatively and conservatively managed patients, that is, those that have undergone ACL reconstruction and those that have been managed conservatively. Second, to compare the effect of open chain exercises when incorporated early versus late. So whether incorporating these exercises early or late in the rehabilitation makes any difference or not. And third, the open chain exercises, will they differ with the amount of resistance applied? So whether high or low resistance has any effect on the knee laxity. Two main interventions in this study are open kinetic chain exercises and closed kinetic chain exercises. Now, what is the difference? In open kinetic chain exercises, the distal segment moves, and in closed kinetic chain exercises, the distal segment usually remains stationary. Example of open kinetic chain exercise is seated knee extension, and squats is an example of closed kinetic chain exercise. In open kinetic chain exercise, the muscle activation occurs primarily in the prime mover, and in closed kinetic chain exercises, the muscle contraction occurs at the proximal and distal segments as well. So, what is the need of this study? Why have the researchers done a systematic review on this topic? Now, traditionally, it was believed that closed kinetic chain exercises are better because open kinetic chain exercises put a greater anterior tibiofemoral stress on the knee ligament. Why? Because in open kinetic chain exercises, there is isolated contraction of the quadriceps muscle, which places a greater strain on the ligament. Whereas in closed kinetic chain exercises, there is a co-contraction of hamstrings and quadriceps. So comparatively, there is very minimal anterior tibiofemoral shear force generated in these kind of exercises. So many studies stated that open kinetic chain exercises should not be incorporated early in the rehabilitation program. Later, studies have shown that whether incorporating open kinetic chain exercises or closed kinetic chain exercises does not make any difference. In fact, incorporating open chain exercises accelerates the quadriceps muscle strength without harming the graft. So this study was done to clear this debate based on the different evidences on this topic. What are the outcome measures that have been used? First, knee joint pain. Second, knee laxity. Third, quadriceps strength. Fourth, functional performance. Pain is measured using numerical pain rating scale and visual analog scale. Knee laxity is measured using an arthrometer. The different devices that have been used are KT 1000 arthrometer, KT 2000 arthrometer, and rollimeter. What is an arthrometer? It is a device that gently pulls the tibia forward and measures the distance it has moved in terms of millimeters compared to femur. If there is excessive movement, it indicates increased knee joint laxity. Quadriceps strength is measured using a dynamometer. Two types have been used. First is a handheld dynamometer and second isokinetic dynamometer. So in some studies handheld dynamometer has been used and in some studies isokinetic dynamometer has been used. What is the difference? Handheld dynamometer measures the quadriceps strength isometrically. There is no movement, resistance is given at a fixed point, and in isokinetic dynamometer the device measures how much force the quadriceps can produce when moved through the range of motion at a fixed speed. Function is measured using different scales and functional performance is measured using hop tests like single hop test, crossover hop test, etc. Talking about the results, so on the different outcome measures, first pain. So early chain exercises, early open chain exercises led to less pain compared to starting them late. Knee laxity, there was no significant difference in laxity with open chain exercises. In fact, some studies showed less laxity in open chain compared to closed chain at early stages. Quadriceps strength, open chain exercises showed greater improvement in quadriceps strength, especially at 3 to 4 months post surgery. And last is function and performance. Both open and closed chain exercises produced similar functional outcomes. No major differences were found in hop tests or knee function scores. So overall, open kinetic chain exercises were either equally effective or superior to closed chain exercises when introduced safely and progressively. How is this study relevant in clinical practice? The most important thing that the study tells is whether we incorporate open chain exercises early or late, it does not have any difference on the knee joint laxity, and therefore we can give open kinetic chain exercises early in the rehabilitation. Next important thing, the rehabilitation should not include only one type of exercise but a combination of both based on proper decision making